Hello, everyone, and welcome to our module on the autonomic nervous system. Let's talk about some of the vocabulary we use when we're talking about the nervous system in the human body. The somatic nervous system is the term used to refer to the nervous system that controls our voluntary actions. These are nerves that innervate skeletal muscles, and they control things like movement, speech, things that are under our voluntary control. The autonomic nervous system, which is what we're going to talk about in this video, is the nervous system that controls involuntary actions. In particular, this nervous system often innervates smooth muscles and glands. Smooth muscles, as you may know, are muscles that are not under our voluntary control. For example, the autonomic nervous system controls things like salivation, constriction of blood vessels. You can't make these things happen by thinking about them because they're not under your voluntary control. And then finally, we often talk about the enteric nervous system. These are the nerves that innervate GI structures in the gut. It's sort of its own nervous system unto itself. So in this video, we're going to focus on the autonomic nervous system, the things under involuntary control. The general way the autonomic nervous system is set up is that when the brain wants to carry out an autonomic action, it sends a signal via a neuron called a preganglionic neuron. The reason this neuron is called preganglionic is because it innervates cells found in the ganglions in the body. Ganglions are clusters of nerve cells. So the preganglionic neuron does not directly carry out any action of the autonomic nervous system. Instead, what it does is it sends a signal to another neuron called a postganglionic neuron, which goes to the effect site and carries out the effect. So in the autonomic nervous system, you're always dealing with a two-neuron system. The first neuron goes from the brain to the ganglions, and the second neuron goes from the ganglions to the effect site. So because of the way the system is set up, there are two important synapses. The first synapse is where the preganglionic neuron synapses onto a cell body within the ganglion, and there is an associated neurotransmitter and receptor for this synapse. The second synapse is where the postganglionic neuron synapses on the effect site, and there is an associated neurotransmitter and receptor for this synapse as well. And as you will see, the particular neurotransmitters and receptors are very important in understanding human physiology and pathology. The two major neurotransmitters used by the autonomic nervous system are acetylcholine and norepinephrine. Acetylcholine has the structure shown here on the screen, and it binds to receptors that are called cholinergic because they bind acetylcholine. Now, there are two subtypes of cholinergic receptors, the nicotinic subtype and the muscarinic subtype. They are named this way because nicotinic receptors can be activated by nicotine and muscarinic receptors can be activated by muscarine. Now, there's no nicotine or muscarine in the human body. They are simply named this way because that's the way you can distinguish them from one another in the laboratory based on whether or not nicotine or muscarine activate the receptors. And then there are many subtypes of the receptors, particularly the muscarinic. So, for example, there are M1 receptors all the way up to M5. These are different subtypes of muscarinic cholinergic receptors that are activated by acetylcholine. The second major neurotransmitter is norepinephrine, which is also called noradrenaline. And because it's also called noradrenaline, the receptors it binds to are called adrenergic. There are two subtypes of adrenergic receptors, alpha and beta receptors. And then there are many subtypes of these like alpha 1, alpha 2, beta 1, all the way to beta 3. We'll talk about all of these in this video later on. There are two systems or two branches within the autonomic nervous system. They are called the sympathetic system and the parasympathetic system. And you probably learned about this in a college biology class, but the sympathetic nervous system activates things that are important for fight or flight, and the parasympathetic system activates things that are important for rest and digest. The systems generally oppose one another. So the way my biochemistry teacher in med school used to tell me to think about it is to picture the woolly mammoth coming over the hill to try and eat your evolutionary ancestors. Those ancestors that had an intact sympathetic system were able to survive and pass on their genes to you. So that's what the sympathetic system is for, fight or flight. Parasympathetic system is largely activated when you're resting. The easiest way to think about this is at night when you sleep, your parasympathetic nervous system is very high, and so things that it can do will happen a lot while you are sleeping. Here's a map of how signals are transmitted through the autonomic nervous system, and we'll refer back to this several times during this video. So if you look at the top, what's shown first is the parasympathetic nervous system. Nerves for this system often come from the medulla. They also come from the sacrum. We'll talk more about that later. The preganglionic neuron is shown here, and it connects to a synapse that uses acetylcholine as a neurotransmitter, and acetylcholine activates nicotinic receptors. That's what the N is for here. Postganglionic neuron goes on to innervate effector sites. It uses acetylcholine as a neurotransmitter and stimulates muscarinic receptors. Next is the sympathetic nervous system. It innervates sweat glands, also many other structures in the body like cardiac and smooth muscle cells and glands, and it also innervates the renal vasculature and smooth muscle there. All of the ganglions for the sympathetic nervous system use acetylcholine as a neurotransmitter on nicotinic receptors, and that's what's shown here. All of these ganglion are close to the spinal cord. That's why they're drawn this way in this picture. For sweat glands, the postganglionic neuron uses acetylcholine as a neurotransmitter on muscarinic receptors. For most of the other functions of the sympathetic nervous system, norepinephrine is the neurotransmitter on alpha and beta receptors. And then finally, a minor neurotransmitter of the sympathetic nervous system is dopamine, which acts on D1 receptors in the kidneys. We'll talk more about that later. Another important action of the sympathetic nervous system is to stimulate the adrenal glands, in particular the adrenal medulla, to release epinephrine and norepinephrine. We'll talk more about this later, but this activity is carried out by acetylcholine as a neurotransmitter on nicotinic receptors. Basically, the adrenal medulla is one big, giant postganglionic neuron that releases epinephrine and norepinephrine into the bloodstream. And then finally, for completeness sake, the somatic system is shown down here on the bottom, which involves skeletal muscle. Skeletal muscles have a single neuron coming from the spinal cord to innervate each muscle cell. The neurotransmitter for this is acetylcholine, and it acts on nicotinic receptors. I briefly touched on this on the last slide, but let me emphasize this point. The sympathetic ganglia are found right near the spinal cord in the paravertebral location. This is shown here on the slide with all the ganglion close to the vertebrae and the spinal cord. They're all found between the T1 and L3 level. That means that anytime the sympathetic nervous system wants to carry out an action, it must first send the signal to the T1 and L3 level, then postganglionic neurons from that point can then go to other parts of the body. The parasympathetic nervous system has preganglionic neurons that are found in the brainstem, in the cranial nerves, and also in the sacrum. For example, you may know that cranial nerve 10, the vagus nerve, is a very important parasympathetic nerve that sends signals to many parts of the body. So because of this anatomy, the parasympathetic nervous system is said to have a craniosacral arrangement. And in contrast to the sympathetic nervous system, the ganglia for the parasympathetic system are found near the target organs. If you look at this drawing on the screen here, it shows a ganglia here out near one of the effector sites for the parasympathetic nervous system. This is in contrast to the sympathetic nervous system where all the ganglia are found paravertebral, right next to the spinal cord. I mentioned this before when we looked at our map of the autonomic nervous system, but I just want to emphasize that all the ganglionic synapses, no matter whether they are part of the sympathetic system or the parasympathetic system, will use acetylcholine as a neurotransmitter on nicotinic receptors. Also important to always remember that nicotinic receptors, in addition to being part of the autonomic nervous system, are found on skeletal muscle. They are of a different subtype called the muscular subtype, but nevertheless they are still nicotinic receptors. And because nicotinic receptors are found on skeletal muscle, the major consequence of nicotinic modulation, whether it's by a drug or disease, will be on the skeletal muscles. When you activate nicotinic receptors, the dominant clinical feature is fasciculations of skeletal muscle. When you block nicotinic receptors, the major clinical consequence is paralysis, and that's why these drugs are sometimes used in anesthesia to paralyze patients. By and large, when you alter nicotinic receptors, the effects are not on the autonomic nervous system. They are largely on the skeletal muscle, and it's high yield to remember that. So going back to this picture, here are the synapses at the ganglions for the parasympathetic system and here for the sympathetic nervous system. All of these have acetylcholine as a neurotransmitter on nicotinic receptors. And then nicotinic receptors with acetylcholine as a neurotransmitter are also found here on skeletal muscle. Now let's talk about how the autonomic nervous system transmits signals to effector sites. And we'll begin with the parasympathetic system because that's the simplest one to understand. Anytime the parasympathetic nervous system wants to carry out an action on an effector site like some smooth muscle cells, it will always use the neurotransmitter acetylcholine, and the receptor will always be a muscarinic type. As I told you before, there are many subtypes of muscarinic receptors. They go from M1 to M5. Most of these subtypes are found in the brain, and they're not important for actions of the parasympathetic system. The two that are most important for carrying out actions of the parasympathetic system are the M2 and M3 subtype. The M2 subtype are found in the heart. They do things like slow down the heart. And then the M3 subtype is found in most other locations. This is the workhorse receptor subtype for the parasympathetic system. You can find M3 receptors in blood vessels, the lungs, the salivary glands. We'll talk about all of these in detail later, but I want to point out to you here that this is the classic receptor subtype for the parasympathetic system. Going back to this slide, this is the parasympathetic system shown at the top here. Anytime an action is going to be carried out, the neurotransmitter will be acetylcholine and the receptor subtype will be muscarinic. Now let's talk about the sympathetic system. The major effector neurotransmitter for this system is norepinephrine. It binds to adrenergic receptors, as I told you before. There are alpha-1 and alpha-2 receptors. There are beta-1, beta-2, and beta-3 receptors. We'll talk about what all these receptors do later on in this video. But the special caveat you have to always remember when talking about the sympathetic nervous system is that the neurotransmitter is not 100% of the time norepinephrine. There are two exceptions. The sympathetic nervous system uses a different neurotransmitter when activating the adrenal glands or sweat glands. The adrenal gland is innervated by the sympathetic nervous system, but the neurotransmitter is not norepinephrine, it's acetylcholine, and the receptor is nicotinic. It's the neuronal subtype, not the muscular subtype, nicotinic receptors. What happens when the sympathetic nervous system activates the adrenal gland is there is a release of hormones into the bloodstream from the adrenal medulla. Basically, the adrenal medulla is a specialized ganglion. That's the way you can think about it. Mostly what it releases into the bloodstream is epinephrine. About 80% of the hormones released from the adrenal medulla are epinephrine. Another 20% is norepinephrine. And this serves to amplify the sympathetic response by sending epinephrine and norepinephrine into the bloodstream, so they are not only activating effector sites via neurotransmission at synapses, but also through the bloodstream. Sweat glands are also activated by the sympathetic nervous system. Once again, this is an exception. Norepinephrine is not the neurotransmitter, it's acetylcholine. Acetylcholine activates the M3 subtype, that common subtype of muscarinic receptor. That's what makes you sweat. If we go back to our map here, this is the sympathetic nervous system with many of its targets listed, including cardiac and smooth muscle cells. Norepinephrine is the workhorse neurotransmitter of the sympathetic system, and it generally activates alpha and beta receptors. The exceptions to norepinephrine being the neurotransmitter for the sympathetic system include the sweat glands, which use acetylcholine and muscarinic receptors, and also the adrenal medulla, which uses acetylcholine and nicotinic receptors. Let's briefly talk about dopamine. Dopamine is a minor neurotransmitter for the sympathetic system. It's released only onto one important place, that's the blood vessels of the kidneys, and when this happens, these blood vessels will vasodilate and increase blood flow to the kidneys. It's important to understand that this only happens at low dosages, so dopamine is often used as a drug to treat shock. The reason it's effective in treating shock is because at high dosages, it doesn't vasodilate blood vessels in the kidneys. Instead, it activates alpha and beta receptors throughout the body. This will raise the heart rate and the cardiac output and cause vasoconstriction, and that's why it's useful for shock. But within the autonomic nervous system, low dosages are released onto renal blood vessels, and that's why it causes vasodilation. And if we go back to our map here, this is the sympathetic nervous system innervating renal blood vessels, the smooth muscle surrounding the blood vessels. It uses dopamine as a neurotransmitter on D1 receptors. In a minute, I'll begin talking about specific organs and how they are affected by the autonomic nervous system. But before I do that, I want to make a general point about smooth muscle. As you know, smooth muscle is the type of muscle in our body that is not under our voluntary control, and therefore it is a major target of the autonomic nervous system. You can find smooth muscle in the arterioles in our vascular system, around bronchioles in the lungs. You can find it in the GI tract and in many, many other locations. The two different systems, the sympathetic nervous system and the parasympathetic, have different effects on smooth muscle. Let's start by talking about the sympathetic nervous system. It can contract or relax smooth muscle tissue depending on which tissue bed it is modulating. Different receptors are found in different tissue beds, and these lead to different effects on smooth muscle cells. But all of these effects are a direct effect of norepinephrine acting on smooth muscle, causing the smooth muscle to either relax or contract. The alpha-1 adrenergic receptors of the sympathetic nervous system are the classic receptor type that leads to contraction of smooth muscle tissue. These are found in vascular smooth muscle in the cardiovascular system. Specifically, they're found surrounding arterioles. These are the resistance vessels of the vascular system. So when these alpha-1 receptors are activated by the sympathetic nervous system, that leads to constriction of arterioles. This is called vasoconstriction. This raises the resistance to blood flow and can raise the blood pressure. And I talk about this in detail in videos in the cardiology section. But you can find these alpha-1 receptors on arterioles in the skin, in the GI tract, and whenever the sympathetic nervous system is activated, these alpha-1 receptors will constrict blood flow to these organs because these are not important as part of the fight or flight response. In other tissue beds, you find beta-2 adrenergic receptors. These are also activated by norepinephrine. They are also part of the sympathetic nervous system. But in this case, activation of the beta-2 receptors leads to smooth muscle relaxation. So you can find these in some blood vessels, for example, in blood vessels of muscle tissue and liver. That's because as part of the fight or flight response, you want more blood flow to these areas. You want more blood flow to your muscles so you can run away from the woolly mammoth, and more blood flow to your liver so you can supply the body with glucose for fuel. And then the major place where you find beta-2 receptors is in the lungs. The bronchioles are surrounded by smooth muscle cells with lots of beta-2 receptors, and therefore when they are activated as part of the sympathetic nervous system, the bronchioles will dilate. This is called bronchodilation, and this allows more oxygen into the lungs as part of the fight or flight response. Now let's talk about the parasympathetic system. It also can contract or relax depending on the vascular bed. There are many locations in the body where the parasympathetic system causes smooth muscle contraction. For example, in the lungs, the parasympathetic system causes bronchoconstriction. In the bladder, the parasympathetic system causes contraction of the detrusor muscle. We'll talk about all of these things later, but these actions are a direct effect of acetylcholine binding to its receptor, just like the actions for the sympathetic system are the direct effect of norepinephrine binding to its receptor. In other tissue beds, the parasympathetic system causes smooth muscle relaxation. For example, in the GI tract, it causes smooth muscle relaxation, which leads to peristalsis. In the penis, it can cause smooth muscle relaxation, which leads to erection. A special thing about smooth muscle relaxation by the parasympathetic system, however, that you have to know for step one is that all of these smooth muscle relaxation effects of the parasympathetic system are indirect effects of acetylcholine. They are not directly caused by acetylcholine binding to its receptor. What acetylcholine does when it wants to cause smooth muscle relaxation through the parasympathetic system is it triggers the release of nitric oxide, a very powerful smooth muscle relaxer. Nitric oxide is also sometimes called endothelium-derived relaxing factor, and it gets its name because it is produced by endothelial cells when they are stimulated by acetylcholine. And in fact, famous experiments have shown that acetylcholine cannot cause smooth muscle relaxation without an intact endothelium. That's because it needs those endothelial cells to produce nitric oxide. So anytime you're talking about smooth muscle relaxation by the parasympathetic system and acetylcholine, you need to be aware that it is an indirect effect of acetylcholine via the intermediate nitric oxide. And nitric oxide can also be produced in response to other substances besides acetylcholine in the parasympathetic system. For example, bradykinin, serotonin, shear forces from blood flow. All of these things can cause smooth muscle relaxation, and they all do so indirectly by stimulating production of nitric oxide. Shown on this slide are all the major organs and systems that are controlled by the autonomic nervous system. And what we're going to do for the rest of this video is go through them one at a time, talk about how the autonomic nervous system works in each place. Let's start with the skin. The skin is the largest organ in the body, and it is under control of the sympathetic nervous system. There are no major parasympathetic nervous system effects on the skin. When the sympathetic nervous system is activated, this leads to vasoconstriction of blood flow to the skin. Alpha-1 receptors are activated, and that decreases the blood flow to the skin. And because the skin is the largest organ in the body, what this does is saves blood for vital organs like the brain and the heart in the setting of the fight or flight response. This also means that when the sympathetic nervous system is activated, the skin becomes cool and cold to the touch. You may know that when people are very frightened, their skin can become cold, and that's because in the setting of fear, the sympathetic nervous system is activated. Now, there are other sympathetic nervous system effects on the skin besides controlling the blood flow. The sympathetic system also activates sweat, so people can be said to have a cold sweat when they are frightened. In addition, the sympathetic nervous system raises the hair on your skin by stimulating erector pili muscles, and this is what gives you goosebumps also when you are frightened. So a cold sweat is what occurs when you are frightened and your sympathetic system is activated. But as you probably know, when you exercise, you get something different. That's called a hot sweat. To understand this, you have to appreciate that blood flow and sweat are not only controlled by the sympathetic system, they are also controlled by heat. Increased temperature in the body is sensed by the hypothalamus, and the hypothalamus will increase the skin blood flow to dissipate heat. By letting more blood flow past the surface of the body, heat will be dissipated. In addition, sweat is a major mechanism by which we dissipate heat because when water evaporates, it takes heat with it. Therefore, when you exercise, what will happen is your body temperature will rise and the blood flow to your skin will increase and you will begin to sweat. That's a hot sweat. And in terms of step one, the most high-yield thing to appreciate about this is that if you cannot sweat, you will develop red flushed skin. If you don't have the ability to sweat, the only way the body can dissipate heat is by increasing the skin blood flow. Therefore, people who cannot sweat get very, very red. And this is important in people who have anticholinergic poisoning. I talk about this in the neurology video on acetylcholine drugs, but people who have anticholinergic poisoning become red as a beet. And the reason they are red as a beet is because they cannot sweat. So let's go through some clinical examples of how the autonomic nervous system modulates the skin in settings of disease. Patients who have heart failure or who are hemorrhaging have massive activation of their sympathetic nervous system. For this reason, they will have cold skin. Patients who have sepsis also have massive sympathetic activation. However, they have two other things going on. They have vasodilation from inflammation. They also have fever, usually from infection. So for this reason, even though the sympathetic nervous system is activated, they won't have cold skin. They'll have warm skin. And that's because these other factors take over the effects of the sympathetic system. Moving on, let's talk about the lungs. The lungs have innervation by both the sympathetic and the parasympathetic nervous system. And the major structures in the lungs that are innervated are the bronchioles, which contain smooth muscle. When the sympathetic nervous system is activated, it triggers bronchodilation in the lungs by causing the smooth muscle to relax and the bronchioles to dilate. This allows more oxygen into the lungs as part of the fight or flight response. This effect is mediated by beta-2 receptors. Remember what I said earlier, beta-2 receptors are the receptors in the sympathetic nervous system that cause relaxation of smooth muscle. And one other special thing about the lungs is that beta-2 receptors in the lungs are famous for the fact that they respond much more to epinephrine than to norepinephrine. This is just sort of a special feature of these receptors. What the parasympathetic system does in the lungs is the opposite. It causes bronchoconstriction, and this is mediated by those typical parasympathetic receptors, the M3 subtype. Some clinical examples of lung autonomic function include wheezing. Patients who are wheezing from anaphylaxis or from asthma can be treated by drugs which activate the sympathetic system because the sympathetic system leads to bronchodilation. So, for example, albuterol is a drug that is a beta agonist. Epinephrine is also a beta agonist. These can be used in people who have wheezing. Ipratropium is a muscarinic antagonist. It's used to treat asthma because when you block the parasympathetic system, you are blocking bronchoconstriction. That leads to dilation. And finally, methacholine is a drug that is a muscarinic agonist. It's used to diagnose asthma. This is called the methacholine challenge. Patients are administered low dosages of methacholine, and if they develop wheezing and bronchoconstriction, it means their lungs are sensitive, and that means they could have asthma. Now let's talk about the heart. 3 elements of the heart are under autonomic control. The heart rate, which is controlled by the SA node, is under autonomic control. Contractility of the ventricles, which is done by myocytes, is under autonomic control. And then finally, conduction velocity through the AV node and the His-Purkinje system are also under autonomic control. So it's fairly easy to understand that the sympathetic system will increase heart rate and contractility, and the parasympathetic system will do the opposite. But never forget that conduction velocity is also affected. So if you look at this EKG tracing, the distance on the EKG from the P wave to the QRS complex is the time it takes for electricity to move through the AV node and the His bundle. That time will become shorter when the sympathetic nervous system is activated, and it will become longer when the parasympathetic system is activated. The sympathetic system activates the heart via beta-1 receptors. They are the classic sympathetic receptor found in the heart. Parasympathetic system innervates the heart by M2 receptors, like I told you before, and this is carried out by the vagus nerve coming from the brainstem. And there are many, many examples of how the heart is affected by drugs in terms of the autonomic nervous system. I'll just go through a couple of them here. Inotropes like dobutamine are beta agonists. They are used in patients with advanced heart failure because they raise the heart rate and contractility. Beta blockers block those beta receptors, and therefore they block the sympathetic nervous system. This leads to slowing of the heart rate and decreased contractility. And these drugs have many, many uses, including hypertension and tachycardia. And then finally, atropine is a drug that is a muscarinic blocker. It is administered to increase the heart rate, and this is used in a number of scenarios. In particular, it's used in patients who have cardiac arrest. The algorithms you go through when running a code for a patient with cardiac arrest often include administering atropine to try and increase the heart rate and get the heart beating again. The kidneys are innervated by the sympathetic nervous system. There are beta-1 receptors in the kidneys. When they're activated, renin is released to activate the RAS system. There are also alpha receptors that constrict the afferent and efferent arterioles. What this does is this decreases the glomerular filtration rate, and that limits sodium and water excretion. So the major consequence in terms of the kidneys of sympathetic activation is to increase sodium and water retention, which is something you want to do in the fight or flight response. You want to hold on to more plasma and more blood. And I talk about this in much greater detail in many of the videos in the renal section. The gastrointestinal tract is innervated by the sympathetic nervous system. There are alpha-1 receptors here, which will decrease blood flow to the GI tract by causing vasoconstriction. And the idea here is just like with the skin, in the setting of the fight or flight response, you want to decrease blood flow to the skin and the GI tract so that that blood can be preserved for organs like the heart and the brain. In addition to decreasing blood flow, the sympathetic nervous system slows the transit and motility in the GI tract by causing constriction of smooth muscle found in places called sphincters. As a result, you get a slowing of motility in the GI tract anytime your sympathetic system is activated. The parasympathetic system does the opposite. It increases motility by causing relaxation of the sphincter. So in terms of clinical relevance, what this means is any drug that has an anticholinergic property can cause constipation. That's because it will block the parasympathetic system's activity of increasing motility. Remember, the parasympathetic system is called the rest and digest system. So when you block that, you slow down the GI tract and get constipation. Also of clinical relevance is that patients who have cholinergic excess for any reason, and I talk about this in the video on acetylcholine drugs, they will develop diarrhea. For example, organophosphate poisoning leads to cholinergic excess, and it classically presents with diarrhea from increased motility of the GI tract. The salivary glands are interesting because saliva production can be increased by either the sympathetic or the parasympathetic system. The sympathetic system tends to trigger production of thick saliva, whereas the parasympathetic system tends to trigger production of watery saliva. Now, although both systems can trigger production of saliva, the parasympathetic system, which is the rest and digest system, is what dominates. This system can be activated by smelling food or seeing food. That will lead to activation of M3 muscarinic receptors, and that's what causes you to produce saliva when you're about to eat. And a clinical tie-in here is that any drug that has anticholinergic properties is going to lead to dry mouth, and that's because it blocks these M3 receptors. Within the vascular system, there is smooth muscle that can be found in the arterioles and also in the veins, and this smooth muscle is under the influence of the sympathetic nervous system. In terms of arterioles, you can find these in the skin, in the GI tract, in the kidneys, and the level of constriction of these arterioles determines the overall resistance to blood flow of the vascular system. In other words, how much these blood vessels are constricted controls the systemic vascular resistance, which I talk about in detail in the cardiology section. So the arterioles are contracted by alpha-1 stimulation by the sympathetic nervous system, and that's very important because that's what raises your SVR in the setting of the fight or flight response. And most people know about this effect of the sympathetic system, but what you never want to forget, especially for step one, is that the veins of the body also have smooth muscle. And when your veins constrict, this pushes blood out of the venous system and to the heart, and therefore it increases the preload. And just like the arteriole, smooth muscle here has alpha-1 receptors, and when they are stimulated, that leads to venous constriction. Let's talk about the eyes. You may know that your eye movements are under voluntary control, but all other things within the eye are under autonomic control. And that includes the pupil diameter and accommodation. So the diameter of your pupil increases when the eye is stimulated by the sympathetic nervous system. There are alpha-1 receptors. These lead to dilation of the pupil, which is also called mydriasis. In contrast, the parasympathetic nervous system via M3 receptors decreases the pupil diameter. This is constriction of the pupil, which is called miosis. Accommodation is altering the shape of the lens of the eye. This happens when the ciliary muscle contracts. This is mostly under parasympathetic control. Your parasympathetic nervous system via M3 receptors can cause constriction of the ciliary muscle, and this leads to an alteration of the lens shape, and this is important for near vision. So the bottom line here is that when your fight or flight response is activated through the sympathetic nervous system, what happens is the pupil dilates to allow more light vision to come in, and the parasympathetic nervous system, which is important for near vision, is less active, and therefore you're more able to perceive far vision. And these are the important things when you're trying to run away from that woolly mammoth. The two muscles in the iris of the eye that control pupillary diameter are shown here. The sphincter pupillae is also called the pupillary constrictor. This is under parasympathetic control. The dilator pupillae, which is also called the radial muscle of the eye, is under sympathetic control, and that's what increases the size of the pupil. A third component of the eye that's under autonomic control is production of aqueous humor. Aqueous humor is fluid that's found in the anterior chamber of the eye, which I'm circling with my pen. I talk about this in more detail in videos on the eye. But for our purposes here, this fluid, the aqueous humor, allows the eye to focus during fight or flight. So as you can imagine, the sympathetic nervous system via beta-2 receptors causes production of aqueous humor fluid. This will raise the intraocular pressure within the eye, and that'll be important in a minute when we talk about glaucoma, which is a problem of elevated pressure within the anterior chamber. In contrast, the parasympathetic nervous system constricts the ciliary muscle, as I told you before. One of the additional effects of constricting that muscle is that it allows aqueous humor to drain from the anterior chamber, and this reduces the intraocular pressure. So the bottom line here is because the sympathetic nervous system produces more aqueous humor, this allows the eye to focus during the fight or flight response. The major clinical tie-in of the autonomic nervous system and the eye has to do with the treatment of glaucoma, which I talk about in detail in another video. But in order to treat glaucoma, which is caused by elevated intraocular pressure, you want to reduce the amount of aqueous humor in the anterior chamber. One way you can do this is by activating the parasympathetic system via muscarinic agonists. Drugs like carbachol and pilocarpine are muscarinic agonists sometimes used in the treatment of glaucoma. You can also block the sympathetic nervous system with beta blockers like timolol, but this has the same effect, less production of aqueous humor. If you've ever gone to the eye doctor and had your pupils dilated, that is done by drugs which modulate the autonomic nervous system. Drugs that activate the sympathetic nervous system will cause pupillary dilation. Cocaine is actually famous for this. One of the first medical uses of cocaine was to dilate the eye, and that's because it can activate the sympathetic nervous system. Obviously, this is not done much in the modern era. Drugs which block the parasympathetic system are often used to dilate the eye. For example, tropicamide is an antimuscarinic drug. The uterus, as you may know, is made up of smooth muscle, so anything made up of smooth muscle is going to have innervation by some branch of the autonomic nervous system. In the case of the uterus, there's innervation by the sympathetic system. There are beta-2 receptors found on uterine smooth muscle cells that lead to relaxation. And the clinical tie-in here is that the drug terbutaline, which is a beta-2 agonist, can be used in preterm labor. This causes the uterus to relax and not contract so that the woman will hopefully stop having contractions and the baby can be allowed to grow until it is old enough to be delivered. There are also alpha receptors that are found in uterus smooth muscle cells, and this is important at the time of delivery because that's when uterine contraction occurs. It's very high yield to know how the bladder works for step one. So there are basically three muscles that control urination. The first one is the detrusor muscle. This is smooth muscle under autonomic control. If you look at this drawing of the bladder here, the detrusor is this large muscle that surrounds the bladder. It's the biggest muscle that's involved in urination, and it's under autonomic control. We'll talk about how it works in a minute. The second muscle is the internal urethral sphincter. So this is found right here. It's at the top of the urethra where it meets the bladder. This is also smooth muscle under autonomic control. And then finally, the external urethral sphincter is found right here at the outlet of the urethra. This has skeletal muscle surrounding it, and it's under voluntary control. So what this means is the sympathetic system, the parasympathetic system, and the somatic system all play a role in urination. Here's a zoomed-in drawing of the bladder. The detrusor muscle is the smooth muscle that surrounds the entire chamber of the bladder. The internal urethral sphincter is found here, and the external urethral sphincter is found here. When your bladder is filling, in other words, during the day when you are not urinating, sympathetic control of the bladder dominates. The detrusor muscle is relaxed. That's from stimulation of beta-3 receptors by sympathetic nerves. The internal urethral sphincter is contracted. That's from sympathetic stimulation of alpha-1 receptors. And your external sphincter, which is under voluntary control, is contracted. When you begin the process of urination, which is also called micturition, everything switches and parasympathetic control begins to dominate. When you decide to urinate, you can voluntarily relax the external urethral sphincter. This initiates a reflex arc which sends signals through parasympathetic nerve fibers to the detrusor muscle so that it contracts via stimulation of M3 receptors. In addition, parasympathetic stimulation to the internal urethral sphincter causes it to relax. This is also done by M3 receptors. The net result is that the two sphincters open up and the detrusor muscle contracts, and this is how you urinate. I've summarized this on this slide here. When the bladder is filling, the dominant system is the sympathetic system, the detrusor muscle is relaxed, and the two sphincters are contracted, including the external sphincter, which is under voluntary or somatic control. During urination, the parasympathetic nervous system dominates, the detrusor muscle contracts, and the two sphincters relax to allow urine to flow. One of the main clinical tie-ins of bladder function has to do with anticholinergic drug. Any drug with anticholinergic properties can inhibit urination. And this is especially a problem among older men who can develop complete urinary obstruction. Many older men have an enlarged prostate from benign prostatic hyperplasia. They need to generate all the force with the detrusor muscle that they can to push urine past that obstruction. If older men are given anticholinergic drugs, they often develop urinary obstruction and are unable to void. There's also a drug called oxybutynin, which is a treatment for overactive bladder, which sometimes leads to incontinence. This drug is an anticholinergic drug, and the idea is to inhibit stimulation of the detrusor muscle so it does not spasm and cause incontinence. And as you should understand now, after all we've been through in this video, some of the common side effects of oxybutynin include constipation and dry mouth. These are classic anticholinergic side effects. It should be fairly easy to understand that in the setting of the fight or flight response, the body wants to raise the amount of glucose and free fatty acids in the plasma because these substances are used as fuel by the body. The sympathetic nervous system does this by altering glucose and lipid metabolism. The sympathetic system can raise the serum glucose concentration by triggering the liver to increase glycogen breakdown, that's glycogenolysis, and also gluconeogenesis. In addition, the sympathetic system can trigger lipolysis in your fat cells, that's the breakdown of triglycerides into free fatty acids. The sympathetic nervous system carries out these actions in a couple of ways. First of all, there is direct innervation of adipose tissue. Beta 1, 2, and 3 receptors have all been described in adipose tissue innervated by the sympathetic system. And then, as we talked about before, one of the things the sympathetic system does is trigger the adrenal gland to release epinephrine. And you should know that epinephrine is an anti-insulin hormone because its effects oppose the effects of insulin. So epinephrine can decrease insulin release by activating pancreatic alpha-2 receptors. It can also decrease glycogen synthesis and increase breakdown by activating hepatic beta-2 receptors. It's also been shown to decrease the storage of fatty acids in adipose tissue. Male sexual function is controlled by the autonomic nervous system. Nerves from the parasympathetic system lead to erection. They cause smooth muscle relaxation, which increases blood flow to the penis. This leads to swelling of the main body of the penis called the corpora, and that's what causes an erection. And because your parasympathetic nervous system is active while you sleep, many men wake up in the morning with an erection. That is because of parasympathetic activation during the night. The sympathetic nervous system controls ejaculation and detumescence, which is the reversal of erection. Therefore, you need both nervous systems in order to have complete male sexual function. Some clinical tie-ins here include erectile dysfunction, which can be treated with the drug sildenafil, also known as Viagra. What this does is relax smooth muscle and basically do the same thing that the parasympathetic system is supposed to normally do. SSRIs are drugs used to treat depression, and a common side effect among men is anorgasmia. The reasons for this are not understood exactly, but one of the hypotheses is that these drugs blunt the central sympathetic nervous system function. And if your sympathetic system isn't working normally, then you will be able to achieve an erection because that's under parasympathetic control, but you will not be able to ejaculate, and that's what causes anorgasmia. I'll finish with this slide and talk about cold temperature, which is a classic activator of the sympathetic nervous system. The reason this nervous system is activated in the setting of exposure to cold is because it can do a couple of things to help raise the temperature of the body. First of all, the sympathetic system can stimulate beta-3 receptors, which are found in brown fat. Most of the fat in our body is white fat, but a small amount of the fat in our body is brown fat. And brown fat is special because it has the ability to generate heat through a process called thermogenesis. This involves manipulation of the electron transport chain, and I talk about it in detail in the biochemistry video on electron transport. But for our purposes here, just know that you have a small amount of brown fat in your body. It can be activated by the sympathetic nervous system to generate heat, and that's why in the setting of cold exposure, your sympathetic system is activated. Note also that there are relatively few beta-3 receptors found in the body, but one of their most famous roles is being found in brown fat. And if beta-3 receptors come up on your step 1 exam, they are most likely going to come up in the context of exposure to cold and brown fat. The second way the sympathetic system can raise your body temperature is by stimulating alpha-1 receptors in the skin. We've talked about this before. This leads to vasoconstriction, and it diverts blood flow away from the skin to preserve heat by keeping blood away from the surface of the body. And then a final way your body can increase the temperature when exposed to cold is through shivering. This is not done by the autonomic nervous system. It's done directly by the hypothalamus, which activates motor neurons to cause muscles to contract over and over. That generates heat. So all three of these mechanisms working together help to prevent low temperatures when you are exposed to cold. That concludes our module on the autonomic nervous system.